Good morning, everybody. This is Heather Thomas with the Joint Information Center for Snohomish County's response to COVID-19. I'm going to take a moment to click buttons to make sure that all of the media who have joined us this morning do have permission to record. You will have permission to record the briefing, and we are also recording, and that link will be made available on the Health District's website later this morning or early afternoon. Give me just a minute. Okay. I think I've given everybody permission to record, but if you run into any issues, please send a message to Joint Information Center using the chat feature, and I will get that fixed. We're joined today by Snohomish County Executive Dave Summers and Snohomish Health District Health Officer Dr. Chris Spitters. Each of our speakers will give an update, and after their remarks, we will take questions using the chat feature. Please make sure to submit your question to everyone so that all of our speakers can see. Thank you for joining us this morning, and with that, I will hand it over to Executive Summers.
Well, thank you, Heather, and good morning, everybody. Thank you for joining us today. I'm going to be really brief today. As you know, the Delta variant continues, and we're in our fifth wave in Snohomish County. Dr. Spitters will go into this in detail, but we have the second highest case counts since the pandemic began, and our numbers are going up rapidly still as of yesterday. And our hospitals continue to see significant pressure, but we aren't quite to the breaking point yet, but it's dangerously close. So we still know two things are true. Getting the vaccine will prevent most serious illness and death, so it is protective. Even though there are cases of people who have been vaccinated being tested positive, again, your chances of getting seriously ill or dying from it are much reduced if you're vaccinated. Not being vaccinated means you have a higher risk of serious illness or death. So those two things are very true and very clear. We've seen reports about a third booster shot. I expect there's going to be great interest in the booster shot, so stay tuned. We will be working to make sure that's available to everybody that wants it throughout the county. So expect that boosters will be part of our future. And I still urge everybody who has not yet been vaccinated, please do so. COVID-19 is a very nasty disease. Even though many are not affected, those that are it's miserable disease. So please get vaccinated and be careful. So with that, I'm going to hand it off to Snohomish Health District Officer, Dr. Chris Spitters.
Well, thank you, Executive Summers, and good morning, everyone. Nearly 1,700 new COVID cases were reported last week, ending on Saturday, the 14th of August, up from 1,300 the prior week, and bringing our two-week rate to 360 cases per 100,000 residents over the two-week period running up through August 14. Currently, 75 people are in Snohomish County hospitals with COVID, and current intensive care unit occupancy is 90%. Why is this happening? Well, just to review, one, an incomplete vaccination effort. We still have over, nearly 250,000 unvaccinated people over 12 years of age in the county who are eligible for vaccination. Reduced implementation of prevention measures over the past couple of months, including masking, social distancing, and gatherings, and obviously the more contagious Delta strain of the virus. The Delta strain is a game changer in multiple ways. First, its ability to spread from one person to another is much greater, and allowed to run free without any prevention interventions. Cases due to previous strains would on average infect 2 to 3 people per case. So if I had COVID 3 to 6 months ago or before, on average, I'd infect 2 to 3 people if no measures were taken by myself or other people to protect against that. With the Delta strain, that figure is closer to 5 to 8 new infections if there are no prevention interventions between the source and recipients of the virus. With Delta, time from exposure to onset of symptoms and onset of contagiousness is also shorter, and the amount of virus in test samples collected from Delta strain patients is about 1,000 times higher than was seen with previous strains. So in short, Delta spreads faster and to more people, and that also makes super spreader events more common too. We're seeing this play out with the rapid increase in the Delta strain and all cases here in Snohomish County, in Washington State, and throughout the country. Now at least 90% of COVID cases in all three levels that I just mentioned are due to Delta. While definitive epidemiologic proof through genotyping hasn't been done, this is likely a cause of the hundreds of cases associated with a music gathering in Grant County called the Watershed Music Festival that occurred at the end of July. And we have at least 30 cases here in Snohomish County alone that are linked to that festival. That just gives you an idea of the speed with which that virus can spread, even in crowded outdoor settings like a music festival. COVID-19 vaccines, as Executive Summers mentioned, are safe and effective at preventing serious illness and death, but it is still possible to become infected. However, that chance of getting infected is at a much lower rate than for vaccinated persons compared to unvaccinated persons. Looking at the data from July in Snohomish County, we see, let's compare May to July. In May, fewer than 5% of cases were among vaccinated individuals. And in July, now that the Delta strain is the overwhelmingly dominant virus in the community, now 20% of cases in July were among vaccinated people. But the protection by the vaccine against the virus, although it's not as stellar as it was in the pre-Delta era, where the effectiveness in preventing infection was greater than 95%, comparing the rates in vaccinated versus unvaccinated people. It's not quite as strong as that. It's probably down into the mid 70 or 80% range, but that's still a dramatic improvement and reduction in risk for illness, hospitalization, and death. So we continue to recommend that anyone who's not vaccinated and eligible go get that done as soon as possible. And it also reduces spread to other people. We can't underestimate that. Vaccines are our best defense, but they can't be our only defense right now. As I mentioned, more and more cases are occurring among the vaccinated for two reasons. One, a greater proportion of the population is vaccinated. In a fully vaccinated population, then virtually all cases would be among vaccinated individuals. But this Delta strain and or time since vaccination in other groups has led to a reduction in the vaccine effectiveness. It's still very effective, but not where it was before. So instead of thinking about vaccination or wearing a mask, we really have to change our mindset to vaccination and wearing a mask, not only to protect ourselves, even the vaccinated, but to protect others as well. This is why the CDC recommends universal indoor masking, regardless of vaccination status, in high transmission areas like Snohomish County and virtually all of Washington State. Masks are primarily about preventing transmission from infected people by covering up the virus at its source so that it doesn't get out into a cloud that other people can breathe in. But those very same masks also reduce the risk of inhaling that cloud that has been generated by someone else. It protects the wearer as well, adding another layer of protection even for vaccinated people. This is all the more important for the Delta strain that will occasionally overcome vaccine immunity, as I've said. Masks also help protect those who cannot get vaccinated, like the 125,000 children under age 12 who are getting ready to go back to school and are not yet eligible for any vaccine product on the market. Unvaccinated people, again, are at a much higher risk of getting sick with COVID and spreading it, as well as developing complications. The higher transmission rate that we're seeing and the increased caseload has made things much worse for an already overburdened healthcare system, with hospitals and ICUs running at over 90% capacity locally and statewide. Hospitals and Washington State's Disaster Medicine Coordination Center are working hard to find hospital beds for everyone that needs one, but increasing COVID hospitalizations are putting us on the brink of not being able to do so. And that is why I issued the masking directive last week for all persons, vaccinated or not, when present in public indoor settings. We need to do everything we can to slow down transmission and prevent the need for more painful restrictions that would be needed to curb the hospital surge if this continues. And as Executive Summers mentioned, while they're currently managing with the difficulty, having to transition into triaging care. That's something none of us want to see for the community, our loved ones, for anyone. We don't take these decisions and actions lightly, and I know that they are not popular with everyone. I recognize that some people, vaccinated or not, find it extremely frustrating to have to go back to wearing masks in public. But we have to do what is right and to protect the community at large, protect the hospital system, and it's my duty to do things to interrupt transmission, even when they're not popular. So if you haven't already done so, mask up in public indoor settings. Please get vaccinated if you haven't already done so. And again, when you're wearing a mask or thinking about it, any public indoor space, grocery store, retail, fitness center, government office buildings where they provide customer service, faith-based services, places like that. Keep a mask with you even when you're outdoors so that you can put it on if you can't stay spread out from other people. If you end up in a crowded outdoor space, clouds of what we call aerosols, what comes out of our mouth, invisible clouds of tiny droplets when we cough, speak, etc. Those hang around, and if you're crowded outdoors, even outdoor transmission can occur. That's clearly been demonstrated. We will continue our efforts to protect Snohomish County. This means supporting confirmed cases and their close contacts and reducing the chances of spread to others, and working with schools, childcare, and businesses to prevent and control outbreaks. So with that, I want to hand it back to you, Executive Summers, and take any questions.
Thank you, Doctor. First question is, what are your expectations for COVID cases as schools resume in a couple of weeks, and what must schools do to handle any outbreaks?
Well, we have there is the Office of the Superintendent of Public Instruction, sort of the state school superintendent. That office, as well as the Department of Health, have issued guidelines for kindergarten through grade 12 schools to operate safely, including the full cascade of interventions, masking for everyone in the building, trying to keep kids spaced out by 3 feet in the classroom, working with public health when cases occur so that contacts can be identified and quarantined, hand hygiene, all that stuff. So that's in place. That's what they need to do. That's what we're working with them on. We meet with them weekly in the lead up to school coming, and we'll meet with them on through the school year to help them do that, not only strategically in terms of preparation, but then dealing with schools and families on a case-by-case basis when cases occur in schools. Young children, unvaccinated, they live in this community, they get infected in the community, they are going to sometimes take it to school and, not know they're sick yet or get tested as a result of a contact investigation and then be positive. So we will see cases in schools just as we did last year. We'll probably even see outbreaks. The goal is to contain, keep the outbreak small, prevent ongoing transmission, and try to keep kids in school, getting educated, and keep the kids, their families, and the school teachers and other staff safe. And I'm confident that although there will be cases and outbreaks, that we can do that and get these kids back in school.
So, Dr. Spitters, do you think a booster shot will help limit the spread of the virus more, even if unvaccinated people still aren't getting the shot?
Okay, well, true and unrelated. Yes, unvaccinated people are the dominant source of transmission and the dominant recipients of transmission. So, getting everyone vaccinated is got to be our highest priority. It's the best tool we have. Now, the booster shots. First, let's talk about two things. There's a third dose, which last week was recommended by the Centers for Disease Control for individuals who are moderately to severely immunosuppressed. That is actually an additional dose in the primary series intended to increase the response among those who did not respond initially. And that's out there now. So we've got that, and that will help prevent infection, disease, severe illness, even death in moderate to severely immunosuppressed individuals. The Centers for Disease Control staff and the Advisory Committee on Immunization Practices continues to monitor the effectiveness of the vaccine in various populations, especially high priority populations like long-term care facility residents, healthcare workers, other elder adults, and looking for declines in effectiveness that would signal a need to give a booster dose. And again, a booster dose, the idea is that's intended for people who had or are anticipated to have had a good response to the vaccine, but either too much time has passed or the virus has changed. And so an additional dose helps boost their antibodies and improve the individual's and the community's ability to prevent transmission. I have to say that right now CDC says that still watching that data and will continue to do so and inform the Advisory Committee on Immunization Practices going forward. They've got several meetings in the next month or two where they keep reviewing this data. And they've stated that at this time, what would trigger implementation of a booster dose would be the regulatory framework, which means the FDA extending an emergency use authorization for that use, that is a booster dose for a specific population or the general population, and then sufficient data to motivate the advisory committee to make a recommendation for its use. And I want to say again at this time, CDC and the Advisory Committee on Immunization Practices have made no recommendation for a booster dose in individuals in the United States.
Okay, do we have any information on outbreaks or level of protection at long-term care facilities?
Sure. Well, things were going along quite well in long-term care facilities until about a month or so ago, and we started to see cases pop up. Usually they're introduced by a visitor or an unvaccinated staff member. Most of the cases, by definition, since vaccine coverage in long-term care facilities was very high in the residents, upward to 90% or better. So there are breakthrough cases, usually a handful. I think we've got about 15 facilities with one or more cases in residents. Most of those are 1 to 3 cases. I think there was one that's now, it's kind of over. It's all the cases have occurred and there haven't been new ones, where they had about 15 cases, but the majority of those are breakthrough. So we are, definitely seeing more COVID activity in long-term care facilities over the past month than we enjoyed in that honeymoon period from March until June, when things were very, very quiet.
Okay. Do you support and want the governor to impose a vaccine mandate for public school employees as well as students age 12 and older?
Well, I'm fully supportive of everyone that's eligible to be vaccinated, getting vaccinated. The means for doing that is, the medical public health statement I just made, and then there are other avenues of interest and discussion in a mandate like that extend beyond public health technical thoughts and recommendations, and I would fully defer to the governor and the superintendent on that.
Any information on how much of the stress on hospitals is a result of shortage of healthcare staffers?
Yeah.
Versus capacity?
Certainly, I don't have quantitative information, but qualitatively, I can tell you this. Here's what's going on in hospitals. First, starting in mid to late June, they just had a surge of non-COVID need for acute care, non-COVID, non-elective care, everything from, bread and butter hospital things like heart attacks and biopsies for cancer and abdominal surgery for abdominal, all that stuff. There's just more of that was happening. A lot of deferred care resulting out of what we've been going through for the past year, and a staffing shortage. And my understanding is that, and again, I can't give quantitative figures on this, but two kind of features going into this. Early on, I think healthcare workers were more willing and able to do extra shifts, work overtime, and such to keep things covered. You can only do that so long. So, and then every facility is competing for staff with other facilities, both in the region and outside the region, who might be, have more interesting offers for healthcare workers. And then some healthcare workers are leaving the field. So all of that combined should be a concern to all of us, not only about the immediate situation, but our future. And so all the more reason to try to do what we can to minimize exacerbating the current surge of routine healthcare demands plus COVID that's hitting the healthcare system now.
Weeks ago, it seemed unlikely that we'd need capacity restrictions on businesses to slow the fifth wave. With case rates and hospitalizations where they are, how close do you think we are to seeing more restrictive measures reimposed?
Well, closer than we were a month ago, but, these are difficult decisions to make. They're not all purely math and numbers. There are a lot of interests at stake beyond just getting the numbers down. And so it's a team sport. And our elected officials generally lead the way on things like that have branching impacts throughout society. And so, obviously we'll be working with Executive Summers and our board if such a time were to come, and we felt the need to do that to protect the healthcare system or for whatever other reason. That could also be thrust upon us at the state level. So all the more reason for us to try to handle it ourselves with common sense, discipline, and doing what's easy. Let's pick the low-hanging fruit, put the masks on, do your regular daily affairs that you need to, but wear the mask and try to, limit unnecessary gatherings that are unmasked and indoors and involve unvaccinated folks. Those are kind of recipes for fueling the fire rather than putting it out.
I'll just add to that as has been the case since day one with this pandemic, it's a rapidly and always changing situation that we've got to assess and look what our options are and what we need to do. That was true last year, and as we know, Delta virus has thrown some wrinkles in that we need to take into account. But we're in talks daily, really, with the governor's office about the best next steps. Again, I think we think the priority at this point is getting people vaccinated and adding some protective measures with masking. I think the possibilities of restrictions in businesses and that sort of thing are still out there, and I think we're looking very closely at the hospital capacity and our ability to treat people. And as I say, we're very bumping close to really getting to that point where there is no capacity and people who desperately need healthcare can't get it because we're full up, and that would change things. And I think it causes us to look at more restrictive measures. But for the time being, I think getting people vaccinated, urging them to do so, is the course we're on. So stay tuned. Who knows? This current spike in cases is very troubling. It's very steep. We're not seeing a leveling off, at least as of yesterday, that I'm aware of. So we'll continue to consult the governor's office about that. What percent of new cases would you estimate are breakthroughs? Doctor, I think you said earlier, currently our recent numbers about 20% are breakthrough cases.
That's right. That's right. Up from, less than 5% prior to June 1, and then a transition period in June. And now the Delta is pretty much everything that's in town. It looks like about 20% of cases in July. And as long as, Delta is ruling the board, that'll be probably 20% of cases. It'll be more if we get more people vaccinated, because, that's the only folks that can get infected. Again, as I said, that in itself is not a failure. What you really want to look at is the rate of cases among the vaccinated, cases per person vaccinated versus cases per person unvaccinated. And we still see about a 75-80% reduction in risk of disease and hospitalization among those who are vaccinated, even with the Delta virus. Before, it was fantastic. It was like 95% better. So it's not as stellar as it used to be, but it's still really good. And one of the best ways to overcome an imperfect vaccine effectiveness, like we're dealing with now, is to get as many people vaccinated as possible. You can overcome deficits in efficacy with widespread high coverage. So again, that's a motivation for us all to not only protect ourselves, but to protect the community.
That 20% rate is consistent with what I've seen in media accounts from Los Angeles and other major centers, and it's the most recent data. I'd say if you go to some of the websites that are tracking this nationwide in different states, you're kind of looking at summaries from a month ago and back, and those rates look lower, but 20% I think seems to be consistent with what I'm hearing from other places. And doctors, you say, as more and more people get vaccinated, the only people that can possibly get it are vaccinated people. So that number is going to go up just with the vaccination rate. If things are this serious, why not make the mask directive a stronger order?
Mm-hmm. Well, speaking from the health officer's position, we, on behalf of the health district and for the good of the public, we issue a variety of different kinds of health officer orders all the time, aimed at, typically they're aimed at individuals or individual enterprises that are not, that are out of line with the law or with reasonable directives that we've made to them. When you go community-wide with an order, generally orders carry the threat or promise of legal consequences or penalties. And so if you're going to do that, you have to have community-wide will and a method of enforcement to do so. And in my judgment, we don't have that right now. A directive has a sort of a thou shalt aspect to it, but it's really instructions for how to behave. And while I think that there's a duty for all of us to comply with that, that's why I issued it. This does not come with any promise or threat of penalties, because I don't have an enforcement plan for this. And so I would like people to feel compelled to do it out of the good, for their own good, but more importantly, for the good of the community. And that's what we're going to have to rely on for now. And I look to Executive Summers to give his input on these thoughts.
Yeah, I think that the directive you issued, most people consider that direction from you to wear masks indoors. I think most of the public doesn't differentiate between directive and an order. So I'm not sure that there'd be much effect. And I'm seeing about just wild estimation on my part, maybe 70% of the folks in grocery stores wearing masks, and which is good, and it seems to increase every day. And that's what happened the first round. At first people were slow to adopt, and as it became more and more prevalent, people got more comfortable with it. So I think that's the course we're on. At some point there's some people that absolutely will not wear masks again, and there's really precious little we can do about it except urge them to, and put sort of peer pressure on them to protect themselves and protect others. So that's the course we're on. I'm comfortable with the current directive at this point, and we could change the word, but we wouldn't be able to enforce it any differently than we can a directive. So Executive Summers, any update on the possibility of requiring vaccines with county employees? Well, it's still under consideration and daily discussion. Just on my mind is we have reinstated, per the health officer's directive, wearing masks indoors at the county campus, public spaces. And so we're taking that very seriously. I'm thinking a whole range of things, from not requiring them all the way up to full requirement, or something in between where people in public spaces and dealing with the public or in close proximity to others might. But we've made no decisions on that. Again, we'll be consulting the health district and the state about that, but have not made any decision on that at this point. Okay, any last questions? Okay, Heather, I think that's it.
Rest of the questions for today, so we'll go ahead and wrap up. Thank you again for joining us and for your questions. We will send out the recording later, and please stay tuned for future media availabilities. Thanks and have a great day.